it's very important for procurement to engage and build rapport at a board level, to articulate the value and the benefit that procurement can bring to an organisation beyond hard savings. So quality, managing risk, improving patient outcomes and clinical outcomes. So there's very much a connection between the ability of the procurement professional to make that connection at a board level, because some boards are disengaged, and if they do engage there, that can help. It can help help procurement deliver these outcomes. So I think that is probably the #1 task for any procurement team, if you haven't got it, is to absolutely build that rapport and connection at a board level, and with non-execs and execs.
I think increasingly as well, procurement have got an ideal opportunity to get involved as part of a bid team where more and more we're competing for contracts. So rather than be receiving the tenders and evaluating them, we can actually contribute in terms of being part of that bid team, looking at it from a different perspective.
I think the other thing is a significant amount of the external spend by any organisation is related to dealing with suppliers and non-paid spend, and procurement have a great influence in tackling that problem. And we need to have more proactive engagement at the board level to be able to, and more power and a bit more empowerment to be able to influence that spend and control it, because we can actually prove that we can provide return on investment in procurement.
And there's a real need to recognise that procurement can't operate in isolation, and that working together with the clinical teams is fundamental to our success, both in the procurement function but across the organisation as well. And engaging in that value conversation as opposed to a price conversation is something that's really, really important, and something that should be talked through at a board level to understand the value proposition of procurement as opposed to the focus on hard savings as we see them.
Well, some of us will have clinical procurement professionals working in our teams. We've got one in surgery who's a senior theatre nurse who's now working for us 3 days a week, and that builds that cohesion between clinical teams and procurement. But absolutely through non-paid programmes and sourcing initiatives, multidiscipline teams drives teamwork, and is a great way to drive a team approach across delivering care in the hospital.
And actually, the procurement profession needs to understand that our remit doesn't focus just on the supply market, just on the price conversation. It's about understanding the clinical implications of procurement decisions and really broadening their horizons, and actually coming to a conversation with the clinical team or clinical individual can be incredibly powerful if it's backed up by clear data and evidence that the procurement function have gained with the supply market or from colleagues outside the organisation, to bring that knowledge and evidence base to the clinical team that actually may support an alternative.
I think identifying a clinical champion, senior clinician within the trust is helpful, and that's certainly where I'm targeting my attention at the moment. But I think also with the Shelford Group we're trying to come up with a standardised model really, so that clinical engagement is looked at across the whole of Shelford rather than left down to individual trusts to interpret. So I think that'll be quite interesting.
I think the other thing as well, actually, this is essentially the difference between being a supplies department and a procurement department. The supplies department is a reactive department, just about providing the end user with a product. Procurement is about adding value, and the concept of category management, which is what best class organisations tend to sort of promote, is about having multidisciplinary teams, like Andy said, which with clinical representation, with finance representation, with any sort of engagement to ensure that it's not just procurement who are doing the project or delivering the project, but it's that team delivering the project to the organisation.
To me, there's a real need to invest in the technology for procurement as the foundations and the building blocks of successful procurement activities and successful procurement function within the organisation. So there is something key about investing in that technology going forward, and about really adopting it at pace.
And the investment, my hobby horse, is investing in people. So we've got to do more in terms of encouraging new people into the profession, targeting universities getting them at source and encouraging them to take a career in procurement, but then providing them a fast-track career so that we meet the challenge of the vacuum that is created in terms of heads of procurement in the future, and an over-reliance on the interim market. So we need to grow our own.
For me, actually, is the real example that collaboration does work in the NHS. Albeit at the regional level, but there are certain examples where you can demonstrate that definitely is effective and working.
And I'd like to suggest 3 rather than 3 that I'm going to take away. So for me, to urge every procurement professional out there, senior lead, to go and engage at a senior level, it really does make a difference. But then 2 specific areas of passion for me. One is know what you spend, invest in spend analytics, skills and capability, because it makes a real difference. And lastly, probably for me the most important area is absolutely focus on internal supply chain waste and efficiency, because I believe and know that there is more money in if you remove waste from the supply chain than delivering hard cost savings on the price of a component.